Hi and a very good evening all of you. Now in this particular lecture I'll be talking about extraoral radiography. Now this is actually, it's not a detailed lecture, it's a kind of review lecture where I'm going to teach you some key tricks and tips to learn this extraoral radiography, because for many students this becomes a very difficult topic. Also I'll be covering the key areas, okay, which you should never miss, okay, like depends upon recently asked questions or probable questions areas and all I'll be covering. So it's a kind of a short lecture, it will not go into every details. It is especially, this lecture is based on exam point of view. Okay, now this will not include the CT and CBCT, which was a live session conducted for the ongoing batch. Okay, so it is other than CT. Okay, now I'll be explaining to you all these different types of extraoral radiography, which includes lateral ceph, SMV, which is submental vertex view, Waters view, PSF, and reverse town. Okay, now don't look into the entire picture now. I'll explain one by one. Okay, now what are the different areas we'll be discussing is where the patient is placed or how the patient is placed, this particular picture. Okay, then how the central beam is directed. This is the central beam direction, and this is the entire picture, how it is actually in patient, what area of skull is visible, and how the resultant image, and more importantly, what is key for your examiners, which view is the best for which particular structure. Like they will ask you, zygomatic arch is best viewed in which particular extraoral radiograph. I just need to give you an overview before we start. Okay, so lateral ceph, you know the lateral ceph which is taken for orthodontic purpose. Now definitely there is other uses also, that's what I'm going to come to. Now the film is placed parallel to the mid-sagittal plane. So please note, only in lateral ceph we use the mid-sagittal plane. All other you see that it's cantomeatal line. I'll tell you what cantomeatal line is. Okay, so film is placed parallel. So this is the film. Okay, you can see this here, and this is the mid-sagittal plane. So this is the sagittal plane at the center of the mid-sagittal plane. So they are kept parallel, and the beam is directed perpendicular to the film. Now that is same for all. Beam is directed perpendicular to the film for all the cases. Okay, that's the common thing. Only thing is, where do you place the film? Okay, and are you tilting your head, and if at all tilting, how you're tilting the head? The central beam is always perpendicular to the film. There is no confusion in that. Okay, so very simple, parallel to the mid-sagittal plane is the position. So means to say that it is from the side, isn't it? You can see it, it is from the side. So what happens? You get the side view. Okay, the side view, this one. Okay, and this is the, you have seen this cephalometric radiograph or lateral ceph. Okay, now see, I'll show you a very important image. This is a key image there. Now see, forget about all this description there. Just see this particular structure, nasal bone. Now, one particular structure very difficult to visualize in your actual other radiograph is your from the anterior view. Okay, visualize is your nasal bone. Okay, you can see this here. This is the nasal bone out there. Okay, I'll show you a better picture to make it easy. Okay, let's come here. Yeah, this is your nasal bone. So to get the nasal bone properly, okay, especially in the radiograph, you need to have a lateral ceph. So this is a key structure what you are looking for in your lateral ceph. Okay, now okay, this is the key structure. Now let's go a little further understanding it. So this is basically the lateral ceph. Even they can ask you image-based questions. So this is the simplest of images. You can get lateral ceph, majorly the nasal bone. Okay, nasal bone and anterior maxilla. Now another radiograph is used for posterior maxilla. Please note, you can see the anterior maxilla here, isn't it? The anterior maxilla is very clearly visualized here. Okay, yeah, when it comes to your posterior maxilla, you can see it here, but better visualization on other radiographs. So anterior maxilla, the image of choice is lateral ceph. Okay, it doesn't mean that other radiographs cannot be used. The image of choice is lateral ceph. So two structures, the image of choice is lateral ceph, majorly the nasal bone and the anterior maxilla, and you know now how the the patient is placed, okay, parallel to the mid-sagittal plane, the patient is placed, and that's it. So now, okay, this is basically the same thing I was telling you. Now, if you come to submental vertex view, so this is the mental region, okay, mental region, isn't it? The mentalis muscle, everything is here. So this is below the mental, submental vertex. Vertex means the center of your skull, vertex region. Okay, so that is the view. So that is the passage of the X-ray beam is from the submental to the vertex. Okay, and that's one reason why this name submental vertex used here. Okay, and how do you place the patient? The patient is placed in such a way that cantomeatal line is parallel to the film. So this is a film, and you have to place the patient where the cantomeatal line is parallel to the film. So like it has to go like this. Okay, the same like you can see there. Okay, this is how, and you place the film. This is the film there. Okay, this is how you place, and you just pass the X-ray beam. Again, central beam is perpendicular to the film always. Okay, central beam is perpendicular to the film. Now you'll ask me, what is cantomeatal line? Just come down. Okay, this is your outer canthus of your eye. This is the external auditory meatus. So this line, this is the cantomeatal. Other name for it is orbitomeatal. Okay, because outer canthus is a part of your orbit. Okay, so that's about the cantomeatal line. So it's parallel, basically SMV, it's parallel. Okay, now there will be small tilt coming now later on. So it's basically now it's kept parallel to the cantomeatal line, and you're just coming down, you see this, see how you can see, this is a picture, this is a visualization. Okay, now very clearly one bone is standing out. What is that? The zygomatic arch, very clear. You can even see the base of skull. This is your actual view, the skull view. You know that in X-ray you can even see your base of your skull. So that is a major area where we are looking into. But yes, it's not over yet. I'll show you more description. Yeah, this is what here. So it's very clear. See, even if an image-based question comes here, okay, it should not confuse you. That this is your particular SMV view. Okay, so if I just slightly decrease the size. Okay, now SMV, what you have to know here is, it is used to know, as I've told you, the zygomatic arch very clearly visible here. See, this zygomatic arch is very clearly visible. Now there is one view which is called as jug handle view. Okay, you know the jug handle, you hold it like the older jugs, two handles there. So this is like kind of a jug handle view where you are decreasing the exposure by 1/3. Okay, than the submental vertex view. So the exposure of your submental vertex view is decreased by 1/3. You get the jug handle view where you can very clearly visualize your zygomatic arch. Okay, so this is what they're talking about. And underexposed SMV. Underexposed SMV is jug handle view, reveals the zygomatic arches better. Now, besides that, you can see, as I've told you, you can see the base of the skull there. Okay, any trauma things out there for the base of the skull, you can visualize it. Now, sphenoid sinus, now very clear here. Okay, this is the sinus, sphenoid sinus. I'll give you a better image to visualize all the sinuses there. Yeah, this is the picture. So, you are very clear about your maxillary sinus, isn't it? Here it is. You know that this is the frontal bone, so you'll have the frontal sinus there. So now this is the ethmoid bone, you'll have the ethmoid sinus. Most people don't know where is sphenoid sinus, so therefore that the side view, this is the sphenoid sinus. Okay, this is the, you know that the sphenoid bone is somewhere here. So you have got the sphenoid sinus. So when you look it in your skull or in your radiograph, you see it in this particular section, okay, slightly behind, isn't it? So this is the major thing. So this picture very clearly tells you can very clearly visualize, don't need to by heart. Zygomatic arch is very clear, the sphenoid sinus is very clear, base of skull is very clear. Any confusion? No, there is no. So that is about your submental vertex view, jug handle view, the same thing. Now, most people are confused here. The Waters view and reverse Townend view. Okay, means to say that which one is head up, which one is head down. So Waters view is head up, reverse Townend is head down. Now, when you're drinking water, see this posture there. you have to lift your head up, isn't it? That's called Waters view, where you're lifting the head up. I'll come to the angle and all. Whereas reverse town, if you just see the modern towns, okay, previously it was, people used to look straight and walk. Now the mobile is there in the hand, so it has reverse. So just remember it like that, okay, reverse town view, okay. So that is in the town, now the view is reversed. But yeah, let's come to the Waters view, where canto-meatal line is at 37 degree with the film. So this is the film, this is the canto-meatal line. Now if you just see this film and canto-meatal line angle, you'll see that it is at 37 degree. This lifted up a plus 37 degree with the film. Okay, this is how it looks like. Okay, it's upwards, and definitely your beam is directed perpendicular to the film, no doubt. Okay, and you see this way. So beautiful view. Okay, the Waters view. So you can see the sinuses here. Okay, you can see different structures here. Majorly, it's the sinuses. I'll come to more structures to see how clear it is. You can see lots of structures out there. But let's see what are the structures you visualize. Okay, before coming to the picture. So this is the Waters view. So now see, can you see the difference? This is the through view. This is very slightly lifted up, isn't it? It's lifted up kind of view. Okay, even if you get an image-based question here, it's not a problem. It's lifted up. You see, this is the straight view, which is the PA view. Now this is the looking downward view. Okay, which is the reverse down. So this three, see, this is very straight. This is looking down, where you have these structures, or I would say this particular area being more clearly visualizable. Okay, some it's not definitely straight, definitely not up. So this was looking up. Okay. Now what are the structures you can see? All these orbital floor or orbit. See this. This is the orbit or infraorbital margin there. This is the infraorbital margin, and you can even see if there is a fracture, orbital floor fracture. Okay, you are just visualizing it, isn't it? It's very clear. Orbital floor fracture zygoma. Please note the difference. This is the zygoma. Okay, sorry, this is not the zygoma. Okay, this particular area, this is the zygoma. This is the orbital floor. You can visualize it. This is the zygoma. This is zygomatic arch. Okay, here, though you can see the zygomatic arch in Waters view, it is more visualized in submental vertex view. So zygomatic arch means what? Zygoma means what? This anterior region. Arch goes back. Okay, it becomes a part of now even your temporal bone part also joins it. Okay, so yeah, you can see the zygomatic bone very clearly there. Then maxillary sinus, no doubt the Waters view is majorly for visualizing your maxillary sinus so beautifully. See this, okay, as well as maxillary fractures. Okay, now there's a small controversy there. We saw anterior maxilla is best viewed in, the first one, this lateral ceph, anterior maxilla. So one of your questions asked in a recent exam, the answer given was which one best visualizes your maxillary fracture, middle third fracture. The answer given was Waters view. Okay, now please note your white and furrow very clearly says that anterior maxilla, it is lateral ceph. Okay, now my personal opinion is to go for lateral ceph if it comes again. Now the key factor to note here is check if there is Waters view or not. If there is a Waters view, okay, then only the confusion comes. I think in the option given, I think there was no lateral ceph. So if there is no lateral ceph, Waters view can be an option, no doubt. Okay. Now other paranasal sinuses also can be visualized here. Okay, if you just see there, okay, little bit of frontal sinuses here like that. Okay, but majorly your maxillary sinus. Now coronoid process of maxilla. Now this is very important. See, if you can visualize here the coronoid process. Yeah, this is the coronoid process. Okay, you need training for that. This one. Okay, if I just enlarge it a little bit more, this is your coronoid process. Now please note, I just need to add here a key factor there. Okay, this is your mandible. Okay, this is your mandible. Now if the patient lifts the head up like this, okay, just imagine this is lifted like upwards for you. Okay, so this coronoid process becomes more easily visualizable. Okay, like this. Okay, now it goes down, your condyle becomes more visualizable. Okay, that is for your which view? Goes down, reverse down. So reverse down, it's like this. You see the condyle, goes up, you see your coronoid. No confusion. Okay, there should not be any confusion which is for coronoid and which is for condyle. Okay, so yeah, what I mean to say here is your Waters view is a key view for your coronoid fractures. Okay, now you can see the coronoid, so it's just going up. So you see directly, you see coronoid, you directly see your sinuses, your bone, orbital bone zygoma. So orbital bone zygoma sinus, very connected. You see your coronoid, no doubt. Look up, you see your coronoid. Okay, so orbital floor, zygoma connected, sinus below that. Other paranasal sinuses, very importantly, your coronoid process. So remember, looking up, you see the coronoid, looking down, you see your condyle. Okay, so no confusion in that part as well. And just to review your previous one, it's very, very clear now. It's zygomatic arch is SMV, and your Waters view is what shows your zygoma. Okay, and sphenoid sinus, again SMV. If you want to see maxillary sinus, it's your Waters view. Okay. Now, it doesn't mean that only this view you can see this particular structure. No, it's a major, like it's the image of choice is what they're talking about. So we saw lateral ceph where the ceph was taken laterally. Now we're going to see the PA ceph, posteroanterior. Okay, patient sitting straight, posteroanteriorly looking, and the image is taken. Okay, now canthomeatal line, though it is not tilted as high as Waters view, it is just 10 degrees, a slight. No, it doesn't mean to say that don't look down, just look straight, a little up. 10 degrees, very, very little. Okay, so canthomeatal line at 10 degree with the film. So basically it's slight tilt upwards and you get it. Okay, this is basically how it looks like, and you have, okay, very clear view of the front. Okay, the front view. So majorly for your mandibular bones, I'm going to show this very soon, okay, in detail. So this is your PA view. Okay, this is your PA view. Now majorly it's used for anterior maxilla. So means to say the what? Lateral ceph and PA ceph is used for anterior maxilla. Okay, lateral ceph and PA ceph, both the ceph are used for anterior maxilla. You can see this anterior maxilla. Please note one additional benefit of PA ceph is your anterior mandible also. So anterior maxilla, anterior mandible in the sense symphysis, okay, and nasal cavity. So it's very much connected, isn't it? We saw lateral ceph, nasal bone and anterior maxilla. PA ceph very much related to it, anterior maxilla, nasal cavity, okay, and definitely your anterior mandible also. So nasal cavity is this, okay, this is the inner part of it, okay. You can clearly visualize it in your this particular picture. If you're just simply looking straight forward, you see what? Your nasal cavity. Whereas if you're looking from the side, very clearly your nasal bone is visible. Okay. So your nasal cavity, now you'll tell me why not this? Actually, in a radiographic view, you have got superimposition of your structures out there. Okay, so the better view you get your nasal cavity doesn't mean to say that nasal cavity is not visualizable, but majorly PA ceph is for nasal cavity. So please understand the difference between nasal bone and nasal cavity. Nasal bone is lateral ceph, nasal cavity is PA ceph. Okay, you have to revise this to get it in, but yeah, then yes, yeah. Zygomatic process of maxilla majorly mean here is your anterior maxilla. Okay, anterior maxilla, you have got your PA view, and yeah, finally you have got your reverse down and OPG. OPG is something which you have been continuously using, but still I'll give you some structures visualizable through your OPGs. Okay, but now reverse down, that's something I told you, looking down. Okay, so your canthomeatal line at -30. Okay, -30, and you look down, mouth open. Okay, so they'll ask you which technique uses mouth open technique. It's your reverse down. Okay, now just imagine someone is watching some video, okay, and all of a sudden shock, mouth open. Okay, so this is how it looks like. Okay, looking down. Okay, and your image, yeah, this is how you get the image. As I've told you, the major view is for condyle. Look up, you see your sinuses. Okay, remember I told you, look up, you see your coronoid process, you see your orbit, okay, orbital bone fracture, your zygoma, okay, come down your maxillary sinus, isn't it? And your coronoid process majorly. Did we miss anything? Yeah, zygoma, maxillary, paranasal, coronoid. Yeah, but now you look down, you see your condyle. Now, yeah, this is, where is your condyle? Yeah, this particular structure is what they're talking about. They're saying that that is condyle. Okay, this is condyle they're talking about there. Okay, hopefully, okay, this is a condyle, it's coming up there. So it's a condyle. Now see, now all these are gone now. People don't use it anymore. You know why? CT, CBCT is even more much better. Now for your exam purpose, it's still the old method. So reverse down is majorly used for neck and body of condyle. You know that your condyle has got that round upper part which is called the body, and coming constricted part which is the neck, isn't it? So neck and body of condyle is your reverse down. Okay, so the simplest of thing I want to tell you is, you look up, you see the coronoid, you look down, you see your condyle. Okay, now then I told you your nasal bone is your lateral ceph along with anterior maxilla, and your nasal cavity with anterior maxilla, anterior mandible, which is symphysis, is your PSF. Now you'll ask me, what about your posterior mandible? Okay, sorry, posterior maxilla. Posterior maxilla is majorly being viewed by your OPG. Okay, posterior maxilla is majorly being viewed using your OPG. So let's come to the structure one by one. Okay, just to finalize. Okay, just to give you a final picture of each structure, how you visualize. Now we have seen what is your individual radiographic image. So this is the mandible region, anterior mandible, mandibular body and ramus, coronoid, condyle. This is anterior maxilla, posterior maxilla, nasal cavity, nasal bone. So it's, I've just divided into different structures: orbit, zygoma, zygomatic arch. Okay, I know things are clicking now, isn't it? Then different sinuses. Okay, all the 4 sinuses. So let's see one by one. Which anterior mandible? We said it's PSF. Okay, anterior mandible, PSF, along with your anterior maxilla, we saw. Okay, so there is no confusion. The body and mandibular body and ramus, like it's going a little bit back. This is where your OPG, panoramic view, comes into play. Now you can also use your lateral oblique view. Oh, it is not shown in the image, that lateral oblique side view. Okay, lateral oblique is slight tilt 15 degree. Patient is asked to tilt, is it slightly 15 degree, and it was given there. You get the body and ramus. Now this is a question for you. Okay, to visualize the ramus and body of mandible, which technique is used? Lateral oblique 15 degree. Okay, if panoramic view is there, you can select that. If that is not there, lateral oblique. Okay, so yeah, you know that the OPG very clearly gives you mandibular body fractures very clearly. In our departments, oral surgery departments, we use only OPG. Okay, so it's very clear, you use this. Now coronoid process, yeah, look up, Waters view. Condyle, look down, reverse down. Okay, so that is about your mandible. Now if you see anterior maxilla, now I'm going to bring you to some controversies now. We said lateral ceph and PSF. Okay, lateral ceph and PSF both can be used. Even your panoramic view can also be used. Okay, but now one of the questions asked you, if you just go through your dental pulse, you will see that Waters view is used. Okay, Waters view is used to visualize maxilla. Now, like I have told you, Waters view is majorly for what you look up, you see coronoid, all those structures, isn't it? So Waters view is this. Okay, now they say that even your maxilla can be visualizable. Now, I am a little controversial here. I say that your first choice has to be panoramic, lateral ceph, PSF. If that is not there, go for your Waters view. Okay, there was a question asked. Now, posterior maxilla, as I've told you, OPG. So, means to say that anterior maxilla and posterior maxilla can be visualized in panoramic view. Please note, your mandibular body also visualizable in your panoramic view, anterior mandible in your PA view. Okay, so now lateral ceph, PSF, we already studied, it is used. Now, nasal bone, lateral ceph, nasal cavity, PSF, we studied. Okay, so where will we study? lateral ceph for nasal bone and anterior maxilla, PSF for nasal cavity and anterior maxilla. So same thing. Okay. Now orbital floor, we said it, look up, you see this thing. Okay, orbital floor and all, water. So how to remember water? Waters, you look up, you see your sinus. Now most of the time your sinus contains air. Now when there is infected, it contains water. Okay, so orbital floor, sinuses. Okay, maxillary sinus. Zygoma, that is your this part. That is again looking up water's view. But zygomatic arch is your SMV, your first or jug handle view. Okay, zygomatic arch. Now very simple, maxillary sinus, very simple, water's view. Now here is small differences. Okay, PSF, lateral ceph. Okay, water's view is for your maxillary sinus. Frontal sinus, if you want to visualize, you can either use your PSF or lateral ceph. Now you see this. Okay, where is our PSF? This is our PSF. So if you want to visualize your frontal sinus, okay, this is your frontal sinus, sorry. This is your frontal sinus. Yeah, exactly. This is your frontal sinus where you can visualize it. So that's a PSF. Okay. Now these are not very important, these sinuses, except maxillary sinus and sphenoid sinus. Sphenoid sinus, we said the first one, submental vertex. You can also use lateral ceph. Okay. Ethmoid sinus, SMV. So it's basically PSF lateral ceph, SMV lateral ceph. Okay, so majorly I just want you to note maxillary sinus. Frontal sinus, PSF. At least remember one, it is your PSF or lateral ceph. Ethmoid sinus, SMV, sphenoid sinus, SMV. Okay, please remember one, SMV. Okay, but others are very crucial and important to know. Okay, so I'll just conclude. So basically, in simplest of terms, in simple terms, lateral ceph, you see your side of your side view, you see your nasal bone and anterior maxilla. You come down submental vertex, you know that zygomatic arch, your base of the skull, and definitely your sphenoid sinus. Okay, jug handle view. Then you look up, you see start with your coronoid, orbital floor, zygoma. Okay, come down maxillary sinus and your coronoid. Okay, your coronoid is where is your coronoid process? Yeah, it is here. This is your coronoid. You look straight, you get your cavity. Instead of, that is lateral surface with the side, you look straight, you see your nasal cavity, anterior maxilla, anterior mandible. Okay, you look down, you see your condyle. So simple it is. Okay, no confusions. So I'll just conclude it here. That's it for today. Thank you so much and have a great day.